Hi, I'm attorney Julie Hauf, and today I want to talk about the self-interested referral disclosure requirements under Florida statute, and this is Florida statute 456.052. First, we'll quickly go through the statute, then we'll talk about how you can use it in litigation, either PIP or BI. So first of all, Florida statute 456.052 talks about how a healthcare provider, prior to a referral to another place that they have an interest in, says that they need to make a written disclosure to the patient prior to the referral. So anything after the fact, something the patient signs when they get to that new location, is not going to be good enough. That written disclosure form that they get prior to the referral needs to disclose both the existence of the investment interest as well as the name and address of each applicable entity in which that investor provider is an investor. They also need to tell that the patient has the right to obtain the services at this place where they're getting referred or to another place, and it is the patient's choice where that new service takes place. The name and address of at least 2 alternative sources to get that treatment, to get that whatever is being referred for, is also required, and this is the area that I see most of these disclosures not comply with what's in the statute. When that disclosure is made, not only does it have to be given to the patient beforehand, it needs to be posted in a conspicuous place in the office of the provider that's making the referral. Failure to comply with that part of the statute is a misdemeanor, and it's also grounds for disciplinary action to the respective board of the provider that's doing that referral. So how can we use that in litigation? Well, first of all, if you think there's been an improper self-interested referral, you might want to try to get those bills struck. You might use the existence of the self-interested referral for impeachment. If the judge doesn't allow any of this in after you've presented all of the evidence and what you're showing and how you want to talk to the jury about this, don't stop there. Preserve your right to come in and look at that post-verdict, kind of like a set-off you might do with health insurance. Keep trying every way you can to get this in. Ask the plaintiff during deposition if they were made any disclosure like this. Look at the patient's chart, include asking for this information in your subpoenas, ask at the deposition of the provider or the provider's billing manager. If you are taking a deposition at the provider's office, get there a little early and look around the lobby for that disclosure. I've done that in the past, taken a picture, and we've used it as an exhibit at the deposition where it doesn't comply. If it's improper, again, and there's a referral, you think this is a way to get money off the damages at trial, keep at it. Keep asking every step of the way to the plaintiff, looking at all the records, asking the provider, asking the people at the provider's office, and if the judge isn't interested in letting that information get into the jury, make sure you preserve your right to have this looked at post-verdict as well. This and all other strategies you can use to get down your plaintiff's damages, we're here and happy to help and talk about whenever you need it. We've got offices located around the state of Florida. Stay well. Thanks.